So good morning.
Yes, the
Hi,
one that
good
is
morning.
missing is Ana Maria Carriazo, Madalena. She hasn't arrived yet.
I think she may also connect later. She has to talk later on.
Okay. Anyway, I'm going to send her a personal email with the connection link, just in case, because
Yes.
just in case. I don't want. Yeah. Ana Maria. One second. I send the email and I am with you. Okay. Okay, done. Whenever you want, Madalena.
Okay. So, good morning, everybody. And on behalf of the Reference Site Collaborative Network, I welcome to this information webinar that is dedicated to the COMFORTage Twinning Call. Thank you so much for joining today. And to those who will listen to the webinar in a registered form due to this holiday season, we are delighted that there has been a growing interest from several organizations across Europe to commit and improve health and care during life course through innovation, collaboration, and knowledge exchange during the past activities of the COMFORTage project. Today's webinar is not only dedicated to present COMFORTage Twinning Call, but is also to illustrate how this initiative can support organizations to learn from one another, to adapt some proven solutions to their own local context and become a part of a COMFORTage growing community of practice. This mission is at the very heart of the RSCN, that brings together regions and organizations with extensive experience in implementation of integrated, person-centered models of care and innovative health solutions. Over the year, the network has evolved into a trusted platform for collaboration, where members exchange experiences, identify common challenges, and jointly develop practical solutions that can be transferred across different health, social, and care systems. One of the key lessons we have learned over time is that innovation creates value only when it can be successfully adopted beyond the place where it was originally developed. This effort requires much more than simply sharing information. It requires a structured knowledge transfer, peer learning, mutual trust, and continuous support throughout the implementation process. This is precisely where twinning initiatives become so valuable. Twinning creates opportunities for regions and organizations to work together, allowing those with established experience to mentor those wishing to implement innovative and validated approaches in their own settings. Twinning transforms isolated good practices into shared European assets, accelerating innovation while respecting the specific organizational, cultural, and policy context of each region. Within COMFORTage, RSCN is proud to support this process by facilitating connections between pilot sites and twinning partners, promoting dialogue across regions, and providing an environment where experience, expertise, and practical lessons can be openly exchanged. Our role is to help build sustainable partnerships that continue beyond the duration of the project and contribute to strengthen regional capacities across Europe. The COMFORTage Twinning Program represents an excellent opportunity to move from individual success stories towards a broader European ecosystem of innovation for healthy living during the life course. By participating, organizations will not only replicate existing solutions, not simply replicate existing solutions, they will work together to adapt, improve, and embed validated innovative good practices into their own social and healthcare system, contributing in turn with their own experience and to enrich the perspective of these innovative solutions. During previous COMFORTage webinars, you have been hearing directly from the COMFORTage consortium about the objectives of the project and the available good practices. Today, we will focus on the opportunities offered by the open call and the practical steps for submitting a successful application. We encourage you to actively participate in the discussion, ask questions, email us if you are going to listen to the registered webinar, and begin exploring potential collaborations with other organizations across Europe. We hope that today's webinar will be the starting point for many new collaborations and that many of you will decide to join COMFORTage Twinning program. Thank you once again for your participation and for listening to the registered webinar, and I wish you an informative and inspiring listening. So I would like to leave the floor now to the first speaker. Silvia, can you share the agenda, please?
Cristiano has the agenda opened.
Okay, so I would like to bring the best greetings from George Manias, and I will share my desktop for next presentation. Just a second. There we go. So COMFORTage has been addressing with a large consortium the demographic challenge with a new vision. Indeed, we all know that by 2050, 1/3 of Europeans will be over 65. So we need a paradigmatic shift from reactive disease management towards proactive anticipatory care during the entire life course, including people over 65. So COMFORTage addresses this challenge, creating a European collaborative ecosystem where digital innovation are combined with person-centered care. The final goal of COMFORTage is to support social and health system in the sustainable adoption of new solutions for prevention and treatment. COMFORTage combines a multidimensional approach, not focusing on a single disease, but combining biological, behavioral, and social factors for healthy living. And it is implemented through 13 European pilot sites that are all working to create robust evidence and implement the innovative solution in a real setting. So the effort of COMFORTage in this final stage is real implementation, and there is an effort also to broaden the community of COMFORTage, and the twinning call is just an effort to broaden this community. The project has one focus of digital innovation around artificial intelligence. The partners have been working on a virtual health platform that is the digital backbone of the entire project and is capable of analyzing complex data derived from the clinical setting, from biomarker analysis and lifestyles to identify personalized risk profiles and thus support personalized interventions that are digitally supported. The second part of the digital ecosystem is indeed the component, is represented by the components that can support personalized interventions, starting from smart environments where sensors and wearable devices are integrated into the living environment and provided to the patients and to the citizens for person-centered care. The project also provides virtual representations that are in the like digital twins that can simulate and adapt preventive interventions to the evolution of health that are dynamic during the life course. And finally, last but not least, there are collaborative spaces like living labs where citizens, practitioners, and researchers co-create solutions to ensure usability and acceptance during implementation. The use case pilots are developed around different scenarios that include hospitals, community care, and they involve policymakers, associations, These clinical activities are implemented through the 13 pilots in 9 European countries, and there are several types of clinical trials that are focused not only on the clinical part, but they also are supported through digital innovation hubs and ensure large-scale social multiplications. There are 5 categories of pilots. The first one is focused on prevention of dementia at community level. The second one is focused on association of dementia with other health conditions. Then we have another categories that is focused in the effort to improve and personalize interventions for dementia. The fourth one is on the study of neuromechanics and fall prevention. And the final one is an observatory on active aging. COMFORTage Community Forum. Sorry. COMFORTage Community Forum is another important environment of COMFORTage, where the project impact can be supported to last beyond the project duration. This COMFORTage forum involves all stakeholders from end users and patients to health and care policymakers, care providers, health professionals, researchers, technological companies, and digital health clusters to share knowledge and ensure that the collaborative environment is fostered to prepare for the twinnings and beyond the duration of the project. The twinnings have been designed to overcome the implementation gap that often follow the foreclosure of innovation projects. And these twinnings are meant to facilitate the transfer of successful innovations to new regions and adopters to reduce the risk that innovations are lost after projects are finalized. And this is not only a transfer of solutions as is, but it is meant to foster collaborations for adaptation, so that the transfer of the transferable elements that are derived from innovative solutions is facilitated to be implemented in a new adopter. The reference site collaborative network will support the program connecting the pilot sites with future twinning partners among the RSCN community and beyond, to facilitate peer learning activities and promote continuous dialogue among stakeholders. And the ultimate goal is to build the legacy of COMFORTage, creating a European community of practice that will be dedicated to advancing active and healthy living during the entire life course through shared innovation. So there are a number of advantages to become a twinning partner, but you will hear more from the new speakers. You will have exclusive access to the good practices of COMFORTage, interact directly with those who created and implemented and tested and validated these innovative good practices. We will provide support to strengthen skills and capacity through collaborations, and you will have the opportunity to develop new collaborations to support long-term digital transformation in your ecosystem. Just a few suggestions. There are a number of good practices available, and you have all the documents in details on the COMFORTage website. This is just suggestions. For example, if your organization wants to focus on community-based dementia, on AI-supported risk prediction, digital cognitive interventions, frail prevention services, falls prevention and rehabilitation, integrated dementia care pathways, living labs, smart homes and ambient-assisted living services, digital health literacy for older adults, and citizen engagement and co-design. There are different pilots who are focused on different area of interest. So this is our final. This is our final slide, and we just believe that successful innovation works on the legs of people. So technology alone cannot ensure that our health system will be sustainable. We need to exploit digital solutions through the engagement of professionals that entrust digital solutions, exploit and implement and demonstrate that they work together. So we want to enrich European evidence-based and collective knowledge, and we invite you to join the twinning program so that you can contribute to create a more resilient healthcare system and improve quality of life in Europe for all citizens. Thank you so much for your attention, and I will leave the floor to the next speaker.
So, Madalena, if you agree, I can share my screen and continue.
Yes, please.
Okay. All right, I think it's fine. Good morning everyone, and thank you very much for joining us today. During the next few minutes, I would like to introduce you to the twinning program, explain why we created, who it is intended for, and what opportunities it offers for organizations interested in innovation for healthy aging. Why COMFORTage twinning? Before talking about the goal itself, I would like to explain why we launched this program. Over the last years, the 13 COMFORTage pilots have developed, tested, and validated innovative approaches addressing frailty, dementia, and healthy aging in very different healthcare and social care settings across Europe. Throughout this work, we realized that many organizations face similar challenges, but they often don't have the opportunity to learn directly from experiences that have already been tested elsewhere. We therefore ask ourselves a simple question: how can we help this innovation travel beyond these pilot sites? The answer is the COMFORTage twinning program. Rather than simply presenting results, we want to create opportunities for organizations to exchange experiences, understand what has worked, discuss local challenges, and explore together how these good practices could be adapted to different contexts. What are COMFORTage twinnings? So, what exactly is a COMFORTage twinning? Simply put, it is a structured collaboration between one of our COMFORTage pilot sites and one or more organizations interested in learning from that experience. The objective is not to copy a solution exactly, as you can imagine, but the idea is to work in a different environment with different regulations, resources, and priorities. And we focus on understanding the transferable elements of each good practice and exploring how they could be adapted to your own local reality. Through this process, participants receive guidance, exchange knowledge with experts, and progressively develop a scaling up that reflects their own ambitions and local contexts. Who can participate? One of the strengths of these programs is its diversity. Innovation in healthy aging does not depend on a single type of organization, as you know. It requires collaboration between healthcare providers, public authorities, researchers, technology developers, community organizations, and many others. For this reason, the call is open to a wide range of stakeholders interested in improving services for older people. We particularly encourage cross-sector collaboration because sustainable innovation usually happens when different perspectives come together. At the heart of the program, there are 13 COMFORTage good practices. They represent the knowledge generated by our pilot sites across Europe after several years of implementation and validation. Each good practice addresses different aspects of healthy aging, from prevention and early detection to integrated care, digital health solutions, artificial intelligence, community support, and living labs. It is, of course, not necessary to become familiar with all of them today. All the information is available on the COMFORTage website, and we are going to comment about this in this meeting later. Why join the program? Well, Madalena has already introduced some of the reasons why joining the program is a very good idea. Yes, so I would like to say that this is an opportunity to learn directly from organizations that have already tested innovative approaches in real-life settings. Participants will also receive methodological support from the COMFORTage group and throughout the program. Beyond learning, the program creates opportunities to establish European partnerships, exchange ideas with peers, participate in study visits, and work together on practical plans for future implementations. We see the twinning program not simply as a project activity, but as a beginning of long-term collaboration within a growing European community committed to health aging. Okay. So, your twinning journey. This is the journey that we have created, yes, for the twinning program. So everything starts with the open call that started, as you know, at the beginning of July. And following this selection of processes, yes, with a series of collaborative activities. These activities include online workshops, expert support, visits, site visits, peer exchange sessions, an intermediate symposium where participants will discuss their progress. So throughout all the journey, each team will progressively develop its own scaling up plan. And finally, all the participants will meet again at the final COMFORTage Twinning Symposium in Brussels, where the result and the future collaboration opportunities will be presented. Here we have some key dates, right? Some of them have already been fulfilled, as you can see. So applications should be submitted before the deadline indicated in the call document. That, as you see, it is the 3rd October 2026. Then a process of evaluation and selection will take place, and the activities are planned to be started in November. The program will continue over the following months, and then all the results and the conclusions will be shared in the final symposium in Brussels. So we encourage you not to wait until the last minute to prepare your applications, as identifying the most suitable good practices and establishing contact with the corresponding pilot may require some time. So we will be pleased, to support you throughout the application process and answer any questions you may have. So thank you very much. And I give the floor to the following speaker.
Yeah, that should be Vincenzo De Luca. Vincenzo, the floor is yours.
Thank you. Good morning to all of you. Now I provide you some practical information to prepare the application. As you understand, it is a twinning, so there are two types of organization involved in the application. One is the originator of the good practices, of the good practice, and another one is the adopter organization. So the application is submitted together. So they need to make they need to make the same application and include both the adopter and organization. More than one adopter can present a twinning application for the same good practice. As Silvia said, there is no specific eligible profile for the organization applying for the call for twinning. Regional and local authorities are welcomed, and also health and social care provider, hospitals, and integrated care networks, housing and assisted living providers, community and non-profit organization, innovation cluster, SMEs, and research policy and public agencies, and digital innovation hubs and competence centers. What is encouraged is cross-sectoral collaboration. For the success of the twinning, it is important to bring on board all the organizations that can give support and can be interested in the adoption or to the adaptation and the adoption of the good practices. And the idea is to include one organization as adopter and to apply to the call for twinning, but to involve in the activity of the twinnings when you will be selected, a network of organization, an ecosystem that is available at the local level that is interested in understand how to adapt and adopt the good practices. The application is composed by it is very simple, so it and also not time consuming. There are two documents to be completed. One is the expression of interest form that include the organizational profile of the originator and adopter, the sector and territorial context in which the good practices will be transferred, the experience in aging, health and social care, innovation of the participating organizations, the motivation for participation, and the indication for specific COMFORTage transferable elements and thematic domains. The other one is the short statement of motivation, in which it is more focused on the good practices, and in this document you should explain why you choose these good practices, why it is important for local challenges and opportunities, what are the key transferable elements that you identified that could be transferred to your local context, what are the stakeholders and the target groups you would like to address, the expected impact and the long-term benefits that you envision, the relevance of participation for each applicant in case of more than one adopting organization, and expectation for knowledge exchange and potential adoption pathways. These two documents are available online, and this online form, at the end of this online form, there is the opportunity to generate a PDF that will be signed by the originator and adopters and sent to and will be sent to a dedicated email that is twinning@rsion.eu. The deadline for the submission of the application is the 3rd of October 2026. And as I said, one or more adopters can apply together for the same good practice. How to successfully apply? First of all, identify the good practices that is aligned with the challenge of your local context, and engage with the referent of these good practices. Very early, avoid the last minute signature, because it is not a good way to approach this call for twinning. Based on the good practices, show the relevance for your local context. This is what the reviewer will evaluate. So how these good practices answer to the challenge, to the needs that you identified in your local context, and make this transfer credible with including the right stakeholder, and also describe the approach you would like to adopt in adapt these good practices, the specific good practices, to your local context. As I said before, bring the right stakeholders in to demonstrate that you are able to engage the local ecosystem, and think beyond the twinning. The twinning is an exercise that could help you to understand what is important to your local context, and how good practice can be adapted and further adopted in your local context. But it is something very brief, and the adoption of innovation needs time, needs adaptation, and what we would see in your application is that you have a plan also beyond the twinning. What is the selection process? First of all, you receive some information today through this webinar, and then you contact the referent of the good practices and start the joint application, and submit it by the deadline of the 3rd October. Then an expert committee, a committee of experts will assess, will analyze, evaluate your application, and select maximum 10 twinnings. And these selected twinnings will be engaged in the twinnings activities, becoming COMFORTage fellow innovators. What are the main aspects that will be evaluated during the evaluation process? The relevance to COMFORTage objectives and transferable elements, the organizational commitment and motivation, the potential feasibility and transfer adaptation, and potential impact on local ecosystem and aging support services, and the capacity for stakeholder engagement and collaboration. Particular attention will be given to diversity of territorial and organizational context, potential for sustainability and scalability, and openness to collaborative learning and exchange. So select an applicant would receive the acknowledgement of COMFORTage fellow innovator. What is the twinning? What are the main activities that the twinning include? First of all, in the first phase, you will participate in the definition of your ambitions building and transfer exploration, in which through a dedicated workshop, online workshop, you will develop in collaboration with the good practices organization to a preliminary ambition statement and scaling up plan. In this document, you understand what are the transferable elements of the transferable elements of the good practices to be transferred to your local context according to the needs and the ecosystem conditions. These outputs, the preliminary ambition statement and scaling up plan, will be updated during the entire twinning activity. So in the next phase will be updated according to the evolution of the twinning, and this online workshop include also facilitated peer-to-peer interaction with the referent of the good practices, and also include a collaborative exercise to highlight the main aspect and transferable elements of the good practice. The second phase is the site visit and local stakeholder meeting. It includes the participation in, it includes the identification of an hosting organization that and during this site visit, the originator and the adopter will meet in person to have a clear idea of the local context and to work together to explore barriers, enablers, and validate the preliminary plan. What we look during the site visit is the contextual adaptation of the good practice according to the specific requirements, organizational needs, and stakeholder needs that they will find in the adoption site. The activities include operational presentation, pilot demonstration of the good practice, stakeholder roundtable discussion, and networking session. Some numbers, some information about the cost of the site visit. So the call for twinning will cover the round trips for 2 participants for each organization for a total of €1,000. In case of one or more than one adopter organization, this round trips cost will be €1,000 more for 2 additional participants. The accommodation is 150 per night per participant. We will cover only 1 night, so the site visit would be at maximum 2 days. We will cover €100 for local transportation, and the hosting organization will receive €300 for the coffee breaks and €500 for light lunch. We will also give the opportunity to cover some logistics and materials cost and organizational support cost. The total estimated budget for the twinning is €2,050 and €500, and additional cost for extra extra adoption organization for more adoption organization are highlighted in the extra cost column. There is budget flexibility, but all the cost should be agreed with RSN, because RSN is the only one that will pay for your cost. So when you will be selected for the twinning, the RSN will contact you asking information about the people that will travel for the site visit, and we will arrange travel and accommodation for your participants. For the coffee break and light lunch, the invoices will be made directly to RSN, and RSN will pay for this cost. And for local transports, the cost will be covered when you will present to RSN a request for reimbursement with your invoices and your bill, and we will reimburse your cost. So this approach is needed because for project needs. So we need to pay this cost according to the rules of the European Commission, and for this reason we created this procedure that should be strictly respected to cover this cost. If you do not respect this approach, your cost could be not covered. Okay, some deadlines. At the beginning of October, the deadline for the application. In October, we will evaluate your application, and in November, we will inform you about the evaluation process and notify about the first workshop. From November to January 2027, the applicants must organize the site visit, and in February the intermediate online symposium, that is the phase 3. It is an update, it is an online symposium to show and demonstrate the progress that you made through through the first workshop and site visit, and update your preliminary plan until March and April 2027, when during the phase 4 you will finalize your final ambitious statement and scale-up plan. And we are organizing for phase 5 the final symposium, that is the final twinning symposium in Brussels, and for the discussion, the final discussion and sharing idea and experience about this call for twinning with European Commission and the project partners. Some also budget information about the twinning symposium. We will cover the participation of applicants to this meeting in Brussels, covering the round trip of 2 participants for applicant organization, and 2 participant hotel cost for 1 night, and local transformation. The approach is the same for the site visit. So you will be contacted by RSN, and requesting the information about the people that will participate in the symposium, and we will arrange your trip, and the reimbursement of local transport will be covered, will be made through the request for reimbursement. These are practical information about the comfort twinning. Additional information are on the COMFORTage website, and I will show later how to find how to find the relevant information in the in the next relations. Thank you. Thank you, Silvia. The floor is yours. I don't know if Anna is connected.
Yes, Anna is connected. So I would like to invite Anna Carriazo to talk about why it is important that you join the twinning program. What's in it for you? So Anna, please, the floor is yours.
Thank you, Madalena, and thank you to the entire community within COMFORTage. And the first thing that I think about when to support the reason for joining this twinning program is diversity. COMFORTage is a wide project, has 13 pilots under 5 categories. There are many opportunities to learn about, but there are also differences among the different territories. And it's not easy to copy and paste the same solutions that is working in an environment to a different one. And that's the main reason of these twinning programs, because knowledge change doesn't go directly from one place to another. And this is the opportunity to go to see and to learn in a more deep, with a deeper way, what is the pilots that are being developed within COMFORTage. What are they working? How are they working? What are the main requirements? The main requirements and the adaptations that you may need to put them in place in your own territory. We live in different sites in Europe with different health system structures, different ways of collaborating between the enterprises, the companies, the academia, the competency centers. They are all part of the reference sites, and they are also part of the wider community of COMFORTage. So the main thing is to learn better about, to get to know more about the different pilots, and also how they can be applied in your own territory. What are the adaptations? The process of, has been very well explained in the previous 2 presentations, Silvia and also by Vincenzo. I think this has been very clear what is the process, but you have to learn a little bit more about the opportunities that the pilots within COMFORTage offer and how you can adapt and to get them to your reality. And to do so, this is the opportunity, the twinning calls. So with this process, it also allows the professionals in the implementing in the recipient territories to learn more and to develop additional capacities that are not already in the place. Healthcare teams differ, and the healthcare structures differ in the different territories. The collaborations between the health and the social care system are also diverse. They have different, the local governments, the regional governments are involved in somehow, and also how these competency centers or research centers are also supporting these activities. So you need to take this difficult to assess from the pilot itself, but this is one of the things that you can learn more when you visit the pilot and try to learn and to clarify how you can transfer the pilot into your territory. It's an opportunity for capacity building within your own teams, in the local team, is a recipient team, to open your mind and learn more about the diversity and the practical knowledge that you learn to apply the new solution in your territory. And also the opportunity of contributing within the COMFORTage tuning program is the pilots are being validated. So it's a validated methodology on how to apply solutions to common challenges that, although there are diversity, you have to select, that you have to adapt, the challenges that we face within the health and care systems in our territories are similar, and has been addressed, and is the main topic within COMFORTage, to address this frailty and dementia challenge and the potential solutions that can be applied at different levels and with different categories of pilots. That is quite a diverse project itself as well. So these methodologies and lessons that had already been learned in the pilots can be also being transferred and learned, and you don't have to fall in the same, to keep the same stone at the beginning. You can avoid initial pitfalls of a project when you learn from the original. And probably the most important thing for this twinning program is that when you get to know the people, you get direct counseling, direct advice, and you make a link between peers that face the same challenges. People that are going to visit the pilot sites, they get a link with that site, and they establish connections that goes beyond the duration of the pilot. The pilot is not very long, I have to say, so you have to focus on the specific aspects that for you are more valuable and that can be implemented in your own territory, to be shared at the final conference that will be beyond around the middle of next year. But it is important to focus on those aspects, on those elements of the pilot that can be transferred, but the collaboration and the link that is established between the pilot and the twinning entity, I think that they last beyond the duration of the pilot, the duration of the project, and they last forever. They continue growing and involving the different organizations that had been involved. And because this is a continuous process of learning and adapting to the new situations that we have, and will help to the overall sustainability of the healthcare system that are facing these challenges with a greater demand in the coming years. So the main idea that I will leave is, I think this is an excellent opportunity. It's not only to travel, that is always good to travel, but also to learn and to see how things are done in other countries with different structures and how you can apply that in your own territory. And that's it will be a process that will be supported by the RACN. If you have any question regarding the whole process, although Vincenzo has explained it very nicely, you will get more support. The documents are in the web page, and you have all the information there. But it's an opportunity for a vision beyond the duration of the project, and to improve the systems that we have to address the needs of the population. So I will encourage people that are in this call, and we will also disseminate this information among all the reference sites and colleagues from the RSCN and beyond, to try to learn from each other, improve the capacity of your professionals, learn about methodologies that have been validated, and to strengthen this European collaboration. That is the good thing that we can have between the member states and also the entities participating in this project. And if you would like to learn, I mean, I have been personally involved in different twinnings, and I keep connections with all the people that we have been in contact in this process. So it's an opportunity for strengthen this European collaboration and to go beyond the duration and secure the sustainability of our healthcare systems. And with this, I finish my presentation, and I think this is the time for question and answers. I will give the floor to Silvia or Madalena.
Thank you, Anna. Thank you so much.
Thank you, Anna.
The floor is open for discussion. So anybody from the audience would like to break the ice, ask questions about the topics, some features of the call that are not clear, the budget, anything. Maybe some clarifications about budget flexibility. I don't know, because this is something I would ask, for example, to Vincenzo.
Yeah. Indeed. I was also
the ice, Vincenzo. I break the ice, Vincenzo.
How to use the budget for doing this?
Yeah. Can you show the slide of the budget, please, so that we can understand better if there are people who are willing to, for example, shift the budget from one voice to another. Can they do it? For example, if they don't want to use local transport, they want to increase the budget for light lunch. How are these amounts intended? Are they max amount? So if they have less than 50 people, they can still have the whole 300 and it's fine. So they can manage the budget with some flexibility. Vincenzo, are you there?
The main budget limit is the total estimated budget. So the applicants cannot spend more than 2,500 euro for the twinning, and all in case we have more than one adopter. This could be increased with the cost included in the extra cost. There are three main types of costs. The first is the travel and accommodation, and this cost is totally covered by RSCN, but also arranged by the RSCN. So when you will be selected, the RSCN will contact you and ask for contact of the participant that will participate in the site visit, and our travel agency will arrange the travel for your participants according to the limit, the cost limit that we have in this table. The second cost item is the local transport, that is the cost for taxi, for metro, etc. And the third cost is for coffee breaks. The other cost category is the coffee breaks sorry, the local transport will be reimbursed to directly to the participant. So the participant that need to be reimbursed send to RSCN a request for reimbursement, including also the receipts, the invoices of the local transport, and we will pay for this cost. The third cost category is the cost for the organization of the meeting, including a coffee break, light lunch, meeting logistics and materials, and organizational support cost. This could be that there is flexibility among this cost category, so you can spend more for meeting logistics and less for coffee breaks and light lunch and vice versa, but the total cost cannot exceed the 2,500 euro. This cost will be covered by RSCN. The hosting organization will provide an estimation of the cost, and the invoice should be addressed directly to RSCN, and RSCN will pay directly the provider. That could be the catering or other company that are providing services.
I think this is a very good reason to apply, because that nobody has to anticipate anything for traveling. So just a few, just the local transportation. The rest, also the organization of the event, is just to provide local estimates and information about the companies to pay. So this is a very good thing. And anybody from the audience would like to ask more questions, please? I don't see any hands raised. So I guess everything was clear. I've seen that maybe George was connected, or is George still connected? George Manias, COMFORTage coordinator.
Hi, Maddalena. Yes,
Hi,
good
George.
morning. Good morning, everyone. Thank you so much. Thank you to everyone that has participated in the call, and especially also to Maddalena, Vincenzo, and Silvia for organizing all the different activities that are needed in the context of the twinning. Also, Anna, for her highly motivated speech. Not many things to add, but what I would like to stress out is that the twinning is the main objective of the twinning is all together to shape a better future for a healthier and more active aging as we progress, tackling, of course, the challenges of dementia and frailty. So I will highlight once again what Anna mentioned about creating a network of peers, a network of collaborators that all together we will exchange knowledge. So far, the project has reached its third year, so prior research has been done, and our pilots have already identified challenges, risks, but also mitigation actions. And these are all contexts that we would like to forward to you in order all together to create better communities and better societies. Thank you once again, and more than happy to follow the activities of the twinning and, of course, the COMFORTage Consortium and the RSCN partner to support each one of you.
Thank you so much, George. So I think also that Anna is right when she says we need to be focused, because the duration is very short. But I swear it will be worthy, because together we can really build a nice environment, and we can share all our results in Brussels upcoming meeting in person. So this is really an important opportunity we have. I would like now to leave the floor to Vincenzo, because we decided to focus the closing to show you where are all the documents in the website. So just a very practical conclusion. The floor is yours, Vincenzo. Show us, please. Vincenzo, we cannot hear you.
Okay. Thank you, Maddalena. This is the COMFORTage website, comfortage.eu. All the information about the goal for twinning is in the open call section. So, I was working on it just 2 minutes before.
And I am trying to enter Vincenzo, and I can't. Anna is here with us, Anna Vizcaino. Anna, could you please help?
I don't know. I don't know why, because for me it's working. I can see it right now, but
can you share it? Because I can't.
Yeah.
I can't either. I can't
maybe
either.
it's some. Look,
I have the same problem as Vincenzo. But if you can share it, that would be great.
Maybe we can hand over to
I
her.
was using a few minutes ago, but it is very strange. Okay, so this is the open call page. If you go down, you and click on term and conditions. Sorry, stop. Terms and conditions. If you click on terms and conditions, you will find the call for twinning with all the information that we introduced today. Go back, please. Okay, scroll down. Okay, and then you will find the good practices. Scroll down, please. So the good practices of COMFORTage twinning. At the end of this short document, you will find the contact person and the email to contact her to participate together. If you click about the pilot, you will find additional information. There are some problems of this that we will
maybe
solve.
today we're having some problems because this morning was working. I was working on that.
Yeah, but me
But
too. I also worked on it, and she was functioning
yeah, maybe
2
something with
minutes
the
ago.
provider or something. I'm going to check that after we finish this,
Yeah,
because this is strange.
if you click on about the pilot, you will find additional information about the good practices and the scopus, objective of the good practices, the context of implementation, and the organization that provide these good practices. So what to do is to access to this section of our website and look at the good practices and select the ones that is more aligned with your context, challenge, and specific needs. And once selected, to contact the referent of each of the good practices you would like to adopt, and collaborate with the contact person to develop your application through the two documents that you will find that you will find in the call for twinning. Because if you access in the call for twinnings, terms and conditions, you will find also the link to the online application form. And it is the document that you need to fill in okay, if you go down. No, it was the terms and condition, the other document, the ones that you opened. Yeah, in this document, there is also the link to the online, the application form. Okay. This is the website. These are the application form. Okay.
Vincenzo, sorry to jump in. I just want to emphasize, yes, you have already said this, but to emphasize that the form has to be completed and sent it to the mail that has been provided. Yes, it's not only a question of completing the form, it also has to be forwarded. Okay,
it has to be signed first. Sorry.
Yes, sure.
Filled in, downloaded, signed by both organizations, the adopter and the other one who is providing the good practice, because both take responsibility for the application, and then sent signed by both applicants by email. We kept the form very simple, but at least one effort you have to sign. It's a matter of taking responsibility for the application, because we know it's not a big amount of money, but it's a very important, nonetheless, it is a very important activity. So in order to valorize your commitments, we expect you to sign and send it to a dedicated email that you see here, twinnings@rscn.eu. So if there are there any other questions? Okay, so we are already late. I thank everybody for connecting, and do not hesitate to send emails with further questions once you have looked at the materials. We are available for you during the whole time of the open call for explanations, further details, or anything else. Just drop us an email and we will be back to you as soon as possible. So thank you so much, and thank you to the speakers for taking their time during sometimes the holiday season. Thank you, Anna, George, Silvia, and Vincenzo, and Cristiano. So thank you everybody for participating, and I wish everybody a wonderful holiday season. Bye-bye.
Thank you.
Bye-bye.
Bye-bye.
Thank you,
Thank you.
Madalena.
Bye-bye.
Thank you,
Bye.
everyone.